I'll ask each panelist to give a quick takeaway on our discussion. Feel free to make any bold predictions that are sure to be wrong since we're on tape. I'll start with you, Sheila.
Well, I think your suggestion, bold predictions, I think the question is really what's unknown. I think we have to anticipate that there will be either actions on the part of the administration on a regulatory basis or an administrative basis that we can't predict today that could have some enormous impacts on either the Medicaid program or the Medicare program. I think it's a 2-year period of time where there is deep division, as Bob has suggested, with little where one sees the opportunity for coming together. Drug prices may be one of those areas, but I worry that, in fact, we will make little progress on some of the other broad healthcare issues about which we are concerned because of that fundamental disagreement as to what the role of the government should be. But I'm expecting and looking forward to the states testing out a lot of things positively, one hopes, in terms of providing services and making things more affordable.
Martin?
Sure. I guess one prediction going forward, as we're sitting here, teachers in the nation's second largest school system, Los Angeles Unified, have recently wrapped up a week-long strike. Teachers in Denver have just voted to authorize a strike of their own. This comes on the heels of statewide walkouts in 6 states, including some quite conservative states, last spring. I think there's a lot of activism around the issue of school spending and teacher salaries right now, and I expect that to continue. Public sector unions, including teachers' unions, recently lost the ability to collect agency fees from non-members for their representation services. They're out there really trying to demonstrate their value, and so I think you'll see continued activism on that front. One last observation. I was wondering about my role on this panel and why it made sense to have one education person alongside multiple health care people. I do think there is a natural connection between the two issues, however, and that's because this question of controlling healthcare costs, which came up in the polling, is one that matters for healthcare and also for education. If we look at why states have reduced their investment in higher education on a per-student basis in the past few decades, the key driver seems to be that they're spending a lot more on Medicaid. So I'm not an expert on the healthcare cost control front, but I hope you all can do a good job because it will matter a lot for those of us who work in education.
Richard?
And actually, Marty, if I could just add one note to that point, and that is the link between education and healthcare. And we know that the social determinants of healthcare and the contributors, education is an enormously important factor in terms of people's access to services and people's understanding. So there is a real linkage there in terms of how to make services available and how people take up those services.
Richard, any quick wrap-ups or predictions for this year?
Yeah, 2 things. I think that we all are clamoring, and the public's clamoring for quick action on drugs and things. I think it's important to have a new conversation. This has been lying dormant for about 7 years since we had the last serious conversation. I think that there are huge problems in Medicare's drug program that will be important to address, and I think having a conversation about how to do that, the negotiation issue, putting down on the table what the ideas are and vetting them carefully, I think is important. Just on one last point, which is slightly different, I think one of the areas that showed up in Bob's poll but also shows up in the sort of state-federal nexus is addressing the opioid problem. And I think there is enormous bipartisan opportunity there, and I think leveraging all the tools we have at both the state and the federal level is incredibly urgent to do, and really should be the major responsibility of this Congress.
Now, Bob, you're the one who monitors trend lines and polls. Where do you see things heading?
The most practical takeaway is 6 months from now, the leaders of the parties are going to go off by themselves, and they're going to ask one question: do we want to run in 2020 having done nothing? And President Trump's going to have to look in the mirror and say, what did I actually enact? And so where there's a big difference about the future is I think you can't be alone in that room and say do nothing. I think something here has to happen. that you actually go back to people and say, this just wasn't a sabbatical. We did something here. But others will write tomorrow, no, the best advantage is to hold hearings and investigations and go home. I just think some of these issues, whether it's education or drug prices, they're actually going to have to act on, because the cynicism of voters that you ran on these dramatic discussions and nothing happened is going to be very, very hard. But that's a prediction of someone who's been wrong quite frequently.
I'm a Washington journalist, so I'm trying not to do any predictions after 2016. So I don't know what's in the Mueller report or what will be in it. I don't know when the shutdown will end or how it will end. And I don't know what the economy will be like a year from now when Democratic voters are going to the Iowa caucus and deciding among 30 to 40 Democratic candidates. But I do know that those three things will be the cloud over these substantive issues as we roll through the next 6, 12, 18 months.